You're the guy people call when they need a helping hand, moving furniture, unloading a truck. But lately, your shoulder's been acting up, and you're the one who's calling for help. And that's the moment you realize you can no longer shoulder the load.
The Joint and Spine Center is Cincinnati's leading destination for orthopedic care, with a range of surgical and non-surgical treatments. So when a moment has the power to change the rest of your life, go to the one place with the power to change it for the better, the Christ Hospital Health Network. This changes everything.
The Pound This Podcast is brought to you by the Christ Hospital Health Network. This is the Pound This Podcast, episode 751, Symptoms and Prevention of the #1 Killer of Women.
I want to lose weight, but I don't know how to get started.
What should I meal prep every week?
How do I get those sweet booty gains?
Inspiration for your healthy lifestyle. The Pound This Podcast with Amanda Valentine.
Thank you so much for listening to the Pound This Podcast. I am Amanda Valentine. I am very excited about my guest today, the medical director of the Women's Heart Center at the Christ Hospital Health Network. I will let you introduce yourself because you say your name so much more beautifully than I could possibly say it. So I'll let you take it from here.
Thank you so much, Amanda. I'm Dr. Quesada, Dr. Odayme Quesada, and I'm very excited to be in the program, especially now with Heart Month coming up, just raising awareness about the importance of heart disease, especially in women.
So tell me all about your background. I know that you are the medical director at the Women's Heart Center, which I definitely want to go into everything that's doing at the Christ Hospital. But where did you start? Where did you grow up? Where did you go to school? How did you get from there to here?
Yeah, I've had a fun journey. So originally actually born in Cuba and moved to the United States when I was young, 7, and raised in Miami, Florida. And interestingly enough, the first time I ever left Florida was actually to go to Yale Medical School, which was an incredible opportunity for me. Before that, I actually stayed in Florida, University of Florida, for my undergraduate. But then, like I said, life took me to the Northeast, where I learned a lot at Yale Medical School and really developed a passion for cardiology. And then went on to internal medicine residency at UCSF in San Francisco. So got to live in the West Coast for some time in a beautiful city. Did incredible experience there, and then decided to proceed with cardiology at the Cedars-Sinai Heart Institute. And then I can talk a little bit more how I got into women's heart disease, but definitely Cedars was a huge influence on that too.
So what made you decide to go specifically into women's heart disease?
Yeah, so it was a little bit of different experiences throughout my training. When I was at Yale, I actually did research with women who were abusing drugs during pregnancy, and we were trying to determine which therapies would decrease them or would increase the chances that they would quit these substances during pregnancy. And I had a looking at how it affected the babies. And then when I went on to UCSF, I became very interested in this population, but more from a cardiac perspective. And we did a project where we looked at the different hemodynamics, or how the heart changed during pregnancy, and in particular during preeclampsia. And I just became very, very interested in preeclampsia as a risk factor for heart disease later in life, and realized that there's a lot that we don't understand about this disease and how it's linked to cardiac disease. And so that really led me to this path of really wanting to become a clinician scientist and not only take care of patients, which is what you go to medical school for, but also do research so that we better understand and fill the gaps that are missing in some of these disease processes. So that really took me very focused to Cedars-Sinai, where I was very, very fortunate to have fantastic mentors. One of them being Noel Berry-Merce, a pioneer in women's heart disease research, and also the medical director of the Barbara Streisand Women's Heart Center. And she took me under her wing, and I really learned to be not only a clinician, but also a researcher in this field of women's heart disease, specifically coronary microvascular dysfunction.
Well, since you're an expert in this field, I definitely want to discuss. I think that most women women, or I don't know, maybe not most, but a lot of women don't realize that women's heart disease differs from men. The symptoms are different than men, which is why we're kind of, you think of the American Heart Association and Go Red, and they focus a lot on women. And I've done so much with them in the past 7 years that I've lived in Cincinnati. And I wasn't aware of all of the differences between heart disease between women and men. So what does that look like from your end, from everything that you do?
Yeah, and first of all, thank you, Amanda, for being such a big advocate for AHA and our message of the importance of heart disease, and especially heart disease in women, because there are a lot of differences. And so I can go through, categorical. There's actually differences in risk factors. We're finally starting to see more data show that there are certain risk factors that are more women specific. For instance, like I was talking about, preeclampsia, which is under the hypertensive disorders of pregnancy, other adverse pregnancy outcomes like preterm delivery or even gestational diabetes. All of these are now being recognized as women-specific risk factors. What does it mean? That if you had that happen during pregnancy, that actually puts you at a higher risk of heart disease later on, and even at an earlier age. Other things like early menopause, another risk factor that's being recognized that's specific to women. In addition to that, what you've talked about, which is that they present differently, is huge, right, Amanda? Mm-hmm. Because women can have a full-blown heart attack and they present differently. I mean, I've seen all of it being described. Just a jaw pain, just left arm pain, or epigastric pain that sometimes they think is just, that they ate something and it's just GI related or related to the stomach, but it isn't. Or all of a sudden they start sweating, like profuse sweating, acute shortness of breath, meaning they get short of breath all of a sudden. And so I've heard all of these presentations, and they are presentations of an acute heart attack. Again, these atypical presentations are more common in women. So what I tell women is, if you don't feel right, if you feel like something is off, it's better to go get evaluated and make sure that nothing concerning is happening. And that would require going to seek care, where they do some blood measures, where they do an EKG, just to make sure that it isn't a heart attack.
Yeah, I've heard so many crazy stories just being involved with the American Heart Association of all these women that I just didn't feel very good and still went on in their day, went to work, took the kids to school, just pushed past it, whatever. And they were having a heart attack or they were in heart failure. And it's just crazy. It just seems more so women than men will just push through that pain rather than stop and be like, okay, something's wrong. I should get this checked out. Where it's like, no, I have to do my checklist first. I'm sure that you see that a lot.
Yeah, definitely. I mean, that's where, we argue that we have to make sure we put ourselves in our own list, right? And so if something doesn't feel right, you have to listen to your body. And it's better just to get checked and make sure that there's nothing, and then really go on with your day. But if we do identify that there's something wrong, it's always better to seek care earlier. And especially during these times of COVID, where I know there's a lot of fear out there that the hospitals are filled with COVID patients, and am I safe? And the reality is you are safe in a hospital. And if you're having these symptoms, or if you don't feel right, it's critical to seek care, because we do take all the precautions to make sure that patients are safe when they're hospitalized for other reasons that are not related to COVID.
So, and I think it's also super important to note that heart disease is the number one killer of women, which I don't feel like is discussed nearly enough.
Yes, and we have to discuss it, because I think the problem is that we think everybody knows this, Amanda, and the reality is that there's a recent study that showed that our knowledge that heart disease is the number one killer, unfortunately, has gone down in the last decade, and we have to change that. We have to increase that knowledge, right? So there's a gap. And I really want to emphasize, since you brought it up, that it's not only the number one killer in all women, it is the number one killer in mothers, meaning it is the number one cause of death, of maternal death. So after someone has a child, the number one cause of death is heart disease. And we also are seeing that there's a rise in heart attacks in young women. So just because you're young, do not think that you cannot have a heart attack. I can't tell you how young I'm seeing some women come in with a heart attack.
So I don't know.
So it's critical.
I don't know if you have the statistics on this or not, but how much of that is possibly preventable?
So a lot of it is definitely preventable. We know that's the thing about heart disease, which is so interesting, that it is the number one killer, is this horrible thing. But if you go down to the risk factors, there is so much we can do and so much that we can reduce that risk, right? Of course, there's things that we don't have control over, but there's a lot of things we do. For instance, never smoke. If you're smoking, quit as soon as possible. We know that's a huge risk factor. Definitely staying active. There's so much amazing research coming out every day about how important physical activity is and how that can truly reduce your risk of all the things that are scary, heart attacks, strokes, etc. And of course, in addition to that, knowing your numbers, because if you know that you have elevated blood pressure, what matters is that we get that under control as soon as possible. If you have elevated cholesterol levels, that we put you on the right medications. And so I think if we do really good prevention, we could really change these statistics about heart disease.
I think that so much of us, especially in marketing and just culturally, we get wrapped up into thinking that eating well and exercise has to equal, like, I have to look a certain way, aesthetics, weight loss, those sorts of things, of just like knowing your numbers and actually taking care of your heart, how important it is just to even get some movement, go for a walk, to protect yourself from chronic disease and health versus, I need to do this in order to look a certain way.
Exactly. And I emphasize that a lot. I emphasize in terms of that topic that yes, BMI is important, but I even emphasize exercise and physical activity more than I focus on BMI. And a lot of my patients, just because the data is showing us more and more that even if you're not at the perfect BMI, if you are physically active, that is actually protecting you in terms of risk of heart disease. And so encouraging every time I can about, getting out there at least 30 minutes a day, 5 days a week from moderate intensity activity goes a very, very long way.
So we know that heart disease is the number one killer of women, but does it go even deeper than that? Does this affect more minorities? Does this affect any certain group of people, or is it just women?
Yeah, so we know that unfortunately, Black women are at a much higher risk of all the risk factors of heart disease, and therefore at a much higher risk of both maternal mortality and just overall mortality and death from heart disease. And this includes MI, stroke, hypertension. I mean, every disease, you name it, unfortunately, Black women are at a higher risk, and therefore even more important to be aware of this, to know your numbers, to know your blood pressure, lipid levels, etc., sooner rather than later, so that we can do some good prevention.
So to just know your numbers, is that just as easy as like seeing your primary care and just getting some basic blood work? And then if something is red flagged from there, then that could be possible that you would move on to a specialist like you?
Exactly. So your numbers means just that, like you said. One of those measures is blood pressure, and I do believe that patients should do that outside of the physician's office, because you only go see your physician every so often. And yes, they'll do it there, but you should be checking it at home, especially if you're at higher risk. But yes, in terms of lab work, yes, that's something that your primary care physician can do some lab work, and then they can calculate a score called your ASCVD risk score, which essentially tells that physician what is your risk of heart disease, and then essentially recommend whether you should be on a cholesterol medication, et cetera, based on that.
So we were discussing, the different symptoms of heart attacks. And I think when we think heart disease, our head goes to heart attack, but there's like so much more than that. What are some of the other heart diseases that you see on a regular basis and that you're researching?
Yeah, I'm very excited to talk about this, because this is something that unfortunately is many times missed. And that's the fact that we have patients, and it could be men and women, but more common in women, that can have symptoms that make us think that they have a blockage of the large arteries. And for instance, they can have the classic chest pressure when they exercise, but in women, it actually can be any of the things we described before, jaw pain, arm pain. So it doesn't have to be the classic, but regardless, the point is they have these symptoms and then they get either a stress test, which is what we do to look for obstructive disease of the arteries, or sometimes they even have the invasive test looking for blockage, and they do not find any blockage of the arteries. And many times these patients are told that there's nothing wrong with them because there's no significant blockage of the large arteries. But instead, what a lot of these patients have is disease of the microvasculature. In other words, coronary microvascular disease is disease of the tiny little vessels in the heart that we can't see, and therefore that is often missed. So I can't tell you how many patients we have coming to our office who have been told for years, even decades, that there's nothing wrong with them, that their symptoms are not related to the heart, but in reality, they actually had very severe small vessel disease. And so that's an area that I'm very passionate about. We are definitely the experts in this field here in the greater Cincinnati region. We have a whole program for this so that women and even men who have these symptoms can seek a second opinion and advocate for themselves. So that's coronary microvascular dysfunction. Another term we use for that is ischemia with no obstructive coronary artery disease, which pretty much means you have some evidence that your heart is not getting enough blood flow, but you don't have any blockage of the large arteries. And this can even present as a heart attack. And more common in women, where a woman can go into the hospital with all the signs of a heart attack. They rush her to the cath lab, and then there's no significant blockage. But now we know that that heart attack was probably caused by other things, and those other diseases are, one of them is spontaneous coronary artery dissection, which is more common in young women. Also stress cardiomyopathy, which is a stress-induced heart dysfunction. There's other things like what we call plaque disruption, meaning that there was a plaque there. By the time they look, it was no longer creating blockage. So it gets a little complicated, Amanda, but I think the main point to make is that not everyone presents with classic blockage of the large arteries. Many times we have to look beyond that.
So I know this is so much of your work at the Women's Heart Center. So kind of tell me everything that, because you've been at the Women's Heart Center for a year and a half, is that correct?
Correct.
And
yes.
So tell me all about that, and what your work you're doing there, and how this is something special in the Cincinnati area.
Yeah, I'm very excited to be here at the Christ Hospital and being able to build the Women's Heart Center from nothing. That's what I was brought here to do by Dr. Tim Henry, who was the chief of cardiology at Cedars and now is actually the medical director of the Lindner Center for Research. So he recruited me here, and what we've been able to build is very special. So in terms of the center, we have multiple programs that are just for women at different stages of their life. So we have an antepartum, postpartum her health program, and that's for women who are either have cardiac disease and are thinking of being pregnant and are pregnant and require more of that expert opinion, or women who have had these adverse pregnancy outcomes, and therefore we should do a lot more prevention for them because they are at a higher risk of heart disease later in life. So after delivery, they come to see us more for a prevention consult. We actually also have a prevention program, the coronary microvascular disease program that I was telling you about. And overall, we specialize in a lot of these diseases that are more common in women and many times require expert opinion. We're also doing a lot of fantastic research as part of the Women's Heart Center. I mentioned a little bit of it, but essentially I have an NIH, which is a National Institute of Health research grant, where we're trying to better understand why women with preeclampsia are at a higher risk of heart disease. So if there's any listeners out there that have an interest in research and had a pregnancy in the last 2 to 10 years and either had a normal pregnancy or a pregnancy complicated by preeclampsia, we would love to get you to help us understand this better. So we're actively recruiting for that study, Amanda. And then we have other really exciting research related to coronary microvascular disease, because we're trying to figure out what is the best treatment for this disease. And we're even doing some very exciting cutting edge research related to stem cells for the more severe patients.
And on the website, if you go to the Christ Hospital and look at the Women's Heart Center, you can find all of that research on there, correct?
Exactly. We're very proud of our website because we wanted to make sure that it essentially showed all the things that we're doing at the Women's Heart Center. Like I said, we have these amazing clinical programs, but we also have a lot of research. So we actually have that research tab, which has the names of all the studies, and you can click and learn more about them. It has the phone numbers to call if you're interested. And also it has an education page. We're very passionate about spreading the word about heart disease, and especially heart disease in women, and these particular diseases that many times go undiagnosed or are underdiagnosed. And so we also have our education page on there.
So what do you see most often in your day-to-day at the hospital? What kind of heart disease are you seeing most women suffer from?
Yeah, so for me, so in terms of what we see the most in our clinic, because we have these specialized programs, we see a lot of women presenting with what I describe, which is that they have had these symptoms of angina, whether it's chest pain, pressure, or anything else, for quite a long time, whether related to exercise, or sometimes they just get them randomly. And those are the ones that get these chest pains randomly are usually the ones that get told the most that there's nothing wrong with them. And we actually are very fortunate here that we have specialized testing. We have the availability of coronary testing called functional angiography, where it's an invasive test, but it goes a step further where it tests for small vessel disease. So we're actually able to diagnose these women with this disease. And for a lot of them, they'll just cry out of happiness that you've given them a diagnosis for something that they've been told is nothing for years to decades. So we see that the most, just because we're constantly spreading the word about this small vessel disease, and women want to know if this is what's causing their pain for all these years.
I think that's just so important that everybody knows that they should be an advocate for themselves. Like if you are having, an intuition that something's not right or something feels off, that you should trust that and follow that through, which can be hard sometimes because it's like life is busy and crazy. And, if one person says you're fine, then you want to believe it. But it's if you're not feeling well, then I feel like you got to kind of chase that down.
Definitely. I'm all about encouraging women to be their own advocate. Because we have seen what a difference that can make in their lives if they get to someone that can make the right diagnosis.
So for anyone listening to this, which I know there's a lot of women listening, and unfortunately, fortunately and unfortunately, that through Heart Month, that this is a great conversation to have, but it's unfortunate that it's only 1 month out of the year, because this is something that we should be discussing. Being the number one killer of women, this is something we should focus on all the time. So what would be your biggest piece of advice, since, you said so much of this is preventative? What can, and outside of if we're feeling pain and be an advocate and see a doctor, like what would be your number one piece of advice for women to do on their day-to-day to try to prevent heart disease?
Yeah, the one thing I really emphasize all the time, and I tell people, if there's one thing you can do, is increase your physical activity. If you can get to those 30 minutes 5 days a week, that's fantastic. And then if you can do more, keep doing more. There's so much amazing data of how protective physical activity is for our hearts, and even for patients with disease. I encourage all of my patients to exercise because it is safe for most of the diseases and it will get them doing more. So for everyone, really, exercise is the way to go, or we can just call it physical activity so no one's scared away from the word exercise.
Yeah, that's where it's just like it's walking is exercise. I think when people hear the word exercise, you think that you have to do some like Olympic lifts and do some CrossFit, where it's just like, no, you can just go for a walk and move your body. Yeah.
Just go walk outside or inside.
Yeah, I mean, I think that's so great. I mean, obviously nutrition and all of those things play a role too, but I think that's important to note of just moving your body. And especially when through COVID, where, you know, a lot of us work from home and then you're sitting and you're sedentary all day, of, you know, just getting up and moving your body can prevent, you know, a heart event, which obviously I don't think anybody wants.
Of course. Yeah. And then, you know, I know we talk a lot about the heart, and cardiologists, we talk more about heart attacks, heart failure. But I think it's important to also, bring up stroke because we know that if people tend to ignore chest discomfort, and also if it presents differently, of course, they ignore it even more. But unfortunately, there's even more strokes that are not presenting on time. And so again, being aware of if you feel that one side of your body has weakness, don't ignore that, right? Seek care right away, because it really can change your outcome if you present early with these symptoms versus late.
And when we can find all of this information, looking up the Women's Heart Center at the Christ Hospital website, right?
Correct. So the easiest way I would say is if you just Google Christ Hospital Women's Heart Center, you will get to our webpage. And of course, the American Heart Association is a fantastic place for all of this good information. We really appreciate AHA, and we work very closely with them to raise awareness of heart disease and all these presentations and when to seek care. So yes.
So I just have to say thank you so much for everything that you do. I mean, being a woman and, you know, trying to prevent heart disease and being so involved with the American Heart Association and really believing in what they're doing, especially for women, of, you know, just getting the awareness out and doing all of that research so that, you know, we do have an advocate of somebody in our corner if we're in pain to really kind of dig through that and figure that out. That, you know, I'm super grateful for you, and also just to be in Cincinnati and to know that this is happening right in my own backyard, and to have these kind of resources is amazing. So thank you so much for all of your research and your work and everything that you do, and helping so many women.
And thank you, Amanda. I mean, thank you for inviting me, and thank you for being part of AHA for all these years and raising awareness. We all have to work together to change that statistic. We all have to work together so that the trend is that there's an increase in the knowledge that heart disease is the #1 killer, and then even more important, that we do something about it.
Yes.
And that we change that statistic together.
For sure. And we'll definitely have to talk again when it's not Heart Month. And I know that you have told me previously about some of the research that you're doing that you're not fully prepared to discuss yet. And I definitely want to discuss that whenever you're able to. So we'll have to do some touch points throughout the year and remind people to take care of their heart.
Absolutely. Absolutely. Would love to do this more than just once a year. Agree with you 1,000,000%. We have to raise awareness throughout the year so that we can really change the statistics.
Awesome. Well, thank you so much for your time. I really appreciated this conversation.
Me too.
AmandaValentineBites.com